I'm back. Hi, you guys. It's Miss Tracy, Original Origins Health and Wellness. But before we get started, I have to give a huge shout out to Perfect Printing, Jabari Wade, my girl Whitney Jones, Shadi, and all the staff there. They do an amazing job. This beautiful retractable banner for Original Origins. So thank you guys. Great job. I'm like over the moon. But anyway, today we are going to talk about chronic kidney disease. So it may be, you may see something on your lab report or the assessment or plan that says CKD, chronic kidney disease. And this is important because I'm seeing this way too much. But the good news is, guess what? It's preventable. So we're going to go about talking about the function of the kidneys and the different stages of kidney disease, and I'm going to give you a little education on how to decipher those labs. You know, when you go to your doctor and they take those labs, it's important that you educate yourself so you know what those numbers mean, because a lot of times there's a lot of hustle bustle to get people in and out, and we really don't take the time as we should probably in the medical field to really go through those labs like we should. But the goal of Original Origins Health and Wellness is to educate, equip, and empower. So I'm going to empower you guys a little bit today on how to decipher through those labs, because guess what? It's not on the doctor, it's not on the nurse, and it's not on the medications, right? You have to take responsibility for your own health. So that's what we're going to do. We're going to empower you today, so hopefully you can do a little better with your health, and this doesn't have to be your story. And if you already have kidney disease, well, guess what? I don't care what you were told, it can be reversed or improved. So we're going to talk about how you can do that. So here we go. So the functions of the kidneys, and I have papers here because I don't have a script or anything, so it's just, I might have to look. It's okay, you know. Anyway, so the kidneys, they have a lot of functions, right? We have two kidneys. Hopefully you have two kidneys, right? They're shaped like kidney beans. They're about fist size, and they kind of sit in the lower part of our backs in that area. So most people kind of know about where the kidneys are. So what a kidney does, so the first function is water, right? So it maintains the balance of water in our body. So it makes sure that we don't have too much water in our body, and it makes sure that we have just enough. So not too much and not too little. So it balances our water just right. It also maintains our blood pressure, right? So it's important for you to have a healthy kidney because it helps maintain our blood pressure. So it makes sure our blood pressure is not too high or too low. Waste. The kidneys remove waste from our system, toxins from the systems that we take in, whether that's drugs, right? Because that's a toxin, medications, all of those things. So the kidneys, they filter up to 200 quarts of fluids in a 24-hour period. 2 of those quarts are excreted in the urine, well, excreted in the form of urine. So that's a lot. If you think about how much a quart is, and our kidneys have to filter 200 quarts in a 24-hour period, your kidneys are working hard. So it's very important to for us to maintain healthy kidney function. Bones. Here's another thing. It activates vitamin D. We also can get vitamin D from the sun, but the kidneys also help to activate vitamin D, which helps our bones to absorb calcium. Acid-base balance. The kidneys help us to maintain our bodies, to make sure it's not too acidic and it's not too alkaline. So kidneys are about balance, keeping our bodies balanced. Heart. This is important. People don't think the kidneys are associated with the heart. We don't often connect that together. So it maintains electrolytes in our body like sodium, potassium, calcium. If we have too much or too little, that can throw our heart out of rhythm, and that's not a good thing. You could die from that. So it's very important for us to maintain proper electrolyte balance. And blood. It releases a substance, a protein called erythropoietin, which is absorbed in the bone marrow, and that signals our bone marrow to produce red blood cells. So the kidneys, they do a lot, so we got to make sure we take care of them. So here we go. The different stages of chronic kidney disease, and there are 5. So stage 1, let me go back and explain when we look at your labs. So when we look at your labs, I look at 3 or 4 things. So it's not just one thing that tells me if my patient has issues with their kidney. So you may have collected what's called a urinalysis. So what we look at the urinalysis is multiple things, but when we're specifically talking about kidney function, there's an area on your urinalysis called protein, or it may say PRO, or it might just spell out protein altogether. That should be completely negative. If it's not, you may have an issue with your kidneys. So make sure you're looking at your lab reports or asking about these things as far as your kidney function. The second thing I look at when you get your blood work done, when you have your labs drawn, we look at something called creatinine. It might be abbreviated as CREAT. Now, if your kidney function is healthy, that number should be 0.5 to about 1.0. However, when you look at your labs, they list what's called a reference range. So I know for where I work at, our reference range for the creatinine is up to 1.3. Well, guess what? I just told you if you have healthy kidneys, that number should not be above 1. So even though that number may fall into the reference range, it's still chronic kidney disease, okay? So you need to learn how to read your labs and what that means. So creatinine level is 0.5 to about 1.0, okay? And then the next one we look at is called microalbumin. Now, if you have high blood pressure, if you already have kidney disease, if you have diabetes, these are automatically checked probably every 6 months or so in those conditions. So with healthy kidneys, microalbumin levels, which is a specific protein in the urine, that should be, our reference lab is less than 20. So if it's greater than 20, it's possible that you could be experiencing other early signs of chronic kidney disease. The last thing that I look at is called an EGFR, estimated glomerular filtration rate. And basically this is how well your kidneys are filtering, because kidneys are filters. So if you have impairment in your kidneys, guess what? They can't work right. They just can't remove the toxins. They can't maintain your blood pressure or any of those things that we talked about. So it's very important that you take care of your kidneys. So we're going to talk about some more good stuff here. So now I'm going to talk about the different stages and some signs and symptoms of chronic kidney disease. So you have 5 stages of kidney disease ranging from 1 to 5. So in stage 1, your EGFR, or your glomerular filtration rate, it may be functioning pretty normal, maybe between 90 and above. But if you're diabetic, if you have high blood pressure, you may have some mild kidney impairment just because of those conditions. So in most cases, if you just maintain your blood pressure right, and for my patients, I'm a little more aggressive. I like their blood pressures to be 120 over 70 or less. But 130 over 80 is probably acceptable. But even if you're there, I always try to get it a little lower. It helps your body just work less harder, and it's just better outcomes for your health. You also want to manage your blood sugar, right? So you want your A1C, which is your 90-day average of your blood sugar. So you want your A1C to be 7% or less. but you really want to probably try to get it down to about the 6% range. But you definitely don't want your blood sugar, yet that A1C, to be greater than 7%. So try to keep your blood sugars on average maybe around 120, 140 or less on average, and you should be okay if you're diabetic. Obesity. You may have mild chronic kidney disease if you're overweight. So we can all use some self-improvement. So just lose some weight, lose a few pounds, and you'll feel better with everything. So stage 2. This is when your glomerular filtration rate is between 60 and 89%. It might not seem like that big of a deal, but that is really the beginning stages of where we really start to see damage to our kidneys. So very important, like I said, maintain your blood pressure, maintain your blood sugar, eat healthy, drink water. The biggest thing I see in my practice is that we just don't drink enough water. And you know I'm always on you guys about drinking water. So you should know by now that we should be drinking half our body weight in ounces every day. So if you weigh 200 pounds, that means 100 ounces a day. But if you have kidney disease or issues with your kidneys, you really should be drinking at least 6 to 8 ounces every hour, because you really have to flush those toxins and things out of your system so they can function better. So you really should be drinking more than that. And again, stage 2, you may not have any symptoms. It just may show up in your labs at this point. Unfortunately, the more you progress, there's not, what am I trying to say? There may not be symptoms until it's progressed to stage 3 or later. So here we go. Stage 3. This is when your kidney function is about 30 to 59, when your GFR is between 30 and 59. This is important because this is the stage where you typically have symptoms. So let's go over some of the symptoms. Sometimes you might have swollen ankles, you may just be swollen, have puffy eyes, things like that. That means you're retaining water. That may be a sign that you have chronic kidney disease, so you need to get that checked out if you're maintaining fluid, retaining fluid. You may feel tired. Some people just feel extremely tired. Why is that? Remember we said the kidneys produce the erythropoietin, which produces red blood cells. Well, if you're anemic, you're not producing as many blood cells, and the oxygen can't get through your body like it should. So you may be fatigued because of that, because of anemia. Back pain. A lot of my patients that have issues with their kidneys, they can pretty much pinpoint in that area where they're having back pain. So it might not be that you strained it or something like that. So learn to listen to your body and get to know your body, so you can tell the difference between your regular kind of back pain from a different type of pain. But any kind of lower back pain in that area, it doesn't hurt to get that checked out. A foamy, dark urine. Our urine should not have foam in it at all. So if that's the case, you may have some issues with your kidneys, and if it's darker. Don't assume because you're not drinking enough water, which that may be the case that you're not drinking enough water, but anything like that, please make sure you go see your healthcare provider to get that checked out. And at this stage, you might have some food restrictions like your phosphorus and sodium, so foods with that. So go get checked out if you have any of those symptoms. Okay, so stage 4. Now that's classified as severe kidney function. So that's when your GFR is between 15 and 29%. So you may have nausea, vomiting. Some people just say they eat and they just get nausea and just feel sick. That may be a sign that you're having issues with your kidneys. Difficulty concentrating, like you just can't focus, you just can't think right. So that's a sign. Tingling in your fingers and toes. If you have any numbness, tingling in your fingers and toes, you need to get that checked out. Just don't assume it's whatever. Just run in, get your kidneys, make sure you're not diabetic, any of those things that can cause the numbness in your toes and fingers. Loss of appetite. You just might not feel like, if you're nauseous and you're vomiting, right, you might not feel like eating. Sleep patterns. A lot of people that have kidney issues, they just don't sleep well at all. So get that checked out. Let's see. Now, you're going to have your diet, in addition to sodium and phosphorus, you're going to have a diet with less potassium. And also, men, before I forget, you may experience loss of sex drive and erectile dysfunction. So between blood pressure, diabetes, and kidney disease can also cause issues with erectile dysfunction. So go ahead, don't just ask for the little happy pill. You know, you need to get that checked out so we can reverse what's going on. So stage 5, this is when your GFR, the glomerular filtration rate, is 15% or less. Okay, people, this is where dialysis come into play. So you may have fatigue, weakness, you may bleed easily, have easy bruising, anemic, so you're tired. You may have excessive thirst. You may feel crampy all the time. You may notice skin color changes, maybe a grayish color to your skin, dry skin. You may stop producing urine. If you notice that you're not producing urine like you should, that's a sign of your kidney function, and you need to get that checked out. So this is the great news, right? All of this at this point, especially before you get to the stage of dialysis, is completely reversible, right? So you can either prevent it, you can reverse it, or you definitely can improve it. The biggest thing you can do is stop drinking the sodas, stop drinking the Powerades, the Gatorades, the Kool-Aid, the lemonade, the sweet tea, all of that kind of stuff. Drink your water. At least half your body weight in ounces every day. Second thing, we eat way too much meat. That is so harsh on our kidneys. So make sure that you, number one, I tell my patients not to eat pork or beef because that's so harsh on our bodies anyway. But if you do eat meat, limit that to 3 ounces per serving. And guess what? You don't need meat every day, and you don't need it with every meal. So keep that in mind, but limit your portion controls. What else you can do? Stop eating the fried foods. We eat way too much fried food. So even if we start there, that's a great start, in addition to watching your sodium and things like that. But if you take those tips right there, you should be able to reverse, or just not even have that be your story altogether. And I'm about to drink my green juice. Until then, your health is your wealth. Thank you for joining me today. I love you guys.